My study is a study of aerobic bacterial and fungal isolates of chronic suppurative otitis media at a tertiary care center in Hyderabad. I am Dr. Chandralekha from Osmania Medical College. CSOM is presence of a perforated tympanic membrane with persistent discharge from the middle ear for more than 2 weeks. The underlying pathology of CSOM is an ongoing cycle of inflammation, ulceration, infection, and granulation. This may continue, destroying surrounding structures and leading to various complications. CSOM with active discharge can be chronic mucosal or chronic squamosal type with cholesteatoma. India falls under high prevalence zone with average prevalence of 7.8%. Aim of the study is to isolate aerobic bacterial and fungal etiological agents of CSOM and to determine antibiotic susceptibility pattern of predominant aerobic bacterial isolates. Inclusion criteria is clinically diagnosed cases of CSOM with active discharge. Exclusion criteria is patients on antibiotics and antifungals for more than 7 days before presenting to ENT department and also immunocompromised patients. Study design is a prospective cross-sectional study. The external auditory meatus was cleaned with alcohol rub to avoid contaminants. Then middle ear discharge was collected with 2 sterile swabs aseptically and transported to the laboratory within 15 minutes. One swab was used for gram staining and KOH mount, and other to inoculate blood agar, McConkey agar, and Stabiros dextrose agar. Standard methods for isolation and identification were used. Antibiotic susceptibility test was done by Kirby-Boyer disc diffusion method. Combined disc synergy test for ESBL and MBL detection in predominant gram-negative isolates was done. Cefoxtin disc diffusion test was done for predominant gram-positive isolates. Coming to the results, in our study, less than 20 years age group was the most predominant age group. Females more than males. Unilateral cases were 97, bilateral 3, monomicrobial 90, and polymicrobial 7. Total number of isolates out of 100 patients were 103, including 3 bilateral cases. Of them, 91 were mucosal kind of CSOM and 9 were from squamosal CSOM. Out of the mucosal CSOM samples, 6 showed no growth, 75 pure bacterial isolates, 7 showed pure fungal isolates, 3 showed mixed bacterial isolates, and 3 showed mixed bacterial and fungal isolates. Out of the 9 squamous CSOM cases with cholesteatoma, 8 showed pure bacterial isolates and 1 showed mixed bacterial isolates. Out of the 8, 7 were Pseudomonas aeruginosa, 1 was Staphylococcus aureus, and 1 was among the mixed bacterial. One case was seen with Proteus and Pseudomonas mixture. Coming to isolates from mucosal type of CSOM, pure bacterial isolates, 42 were Pseudomonas aeruginosa, 25 Staphylococcus aureus, 4 Proteus, 2 Klebsiella, and 2 E. coli. And pure fungal isolates were 7, 5 Aspergillus, that is 3 Niger and 2 Fumigatus, and 2 were Candida, that is both were Candida albicans. Coming to mixed bacterial isolates were 3. Among them, 1 was Pseudomonas aeruginosa plus Staphylococcus aureus, and 2 were Proteus plus Staphylococcus aureus. And among the 3 mixed bacterial and fungal isolates, 1 was Pseudomonas aeruginosa plus Candida albicans, and 1 was Staph aureus plus Candida albicans, and 1 was Staph aureus plus Aspergillus niger. These are the pictures. Coming to antibiotic susceptibility pattern of Pseudomonas aeruginosa isolates, among all the antibiotics tested, amikacin and ciprofloxacin showed high sensitivity, amikacin 100% and ciprofloxacin 95%. And among the Pseudomonas aeruginosa isolates, 28.8% were MDR, and 23% were ESBL, and 15.3% were MBL. Coming to antibiotic susceptibility pattern of Staphylococcus aureus isolates, 52% were MSSA and 48% were MRSA. And gentamicin, ciprofloxacin showed highest sensitivity. All the isolates were sensitive to vancomycin, linezolid, and ticoplanin. Out of the 103 samples collected from 100 patients, there were 94 bacterial and 10 fungal isolates. 6 samples were culture negative. Bacterial isolates were more prevalent than fungal. Among both mucosal and squamosal type of CSOM, Pseudomonas was the first common isolate, followed by Staphylococcus aureus. Pseudomonas aeruginosa was 55.3%, and Staphylococcus aureus was 34%, and Proteus 6.3% on the whole. Among the 10 fungal isolates, 60% were Aspergillus species and 40% Candida species. Amikacin and ciprofloxacin showed high sensitivity. All the isolates of Pseudomonas aeruginosa isolated from squamous CSOM cases were MDR. Overall prevalence of MDR was 38% in our study. Our study correlated with Pavani et al., Madhuri et al., and Nilaveni et al. But in Pavani et al. Study, 21 to 30 age group was most predominant, and poor living conditions were the common demographic features in all the studies, and unilateral cases were more than bilateral. Our study also correlated in case of prevalence of fungal isolates and polymicrobial isolates with the other studies. And coming to most common isolates, Pseudomonas was the most common isolates in various studies. And in Pavani et al., Proteus was the second most common isolates, in contrast to our study where Staphylococcus aureus was the second most common isolate. And MDR was 38% in our study, and it was higher in Nilaveni et al., that is 44.4%. In our study, amikacin and ciprofloxacin showed highest sensitivity in contrast to Nineveh et al., where imipenem and piperacillin tazobactam showed 100% sensitivity. And percentage prevalence of MRSA in our study was 48%. In Pavani et al., it was higher, that is 59%. And other uncommon isolates isolated in Pavani et al. Were Acinetobacter 2% and Enterococcus 1%. In our study, the combination of Proteus and Staphylococcus aureus was seen. And in our study, 23% ESBL producers among Pseudomonas aeruginosa were there, which was higher than Adadula et al. In 2020, which who got 13%. And in our study, MBL production was 15.3% among Pseudomonas aeruginosa isolates, whereas in Nilevini et al. It was higher, that is 29.1%. To conclude, emerging MDR poses significant threat to treatment failure and development of complications. Therefore, evaluation of microbiological pattern in local area becomes helpful in prescribing empirical antibiotics for successful treatment and thus minimizing its complications. And it is desirable for laboratory to culture all the cases of CSOM for bacteria and